Recently, stem cell therapy was officially approved under the new medical technology framework. That applies to both bone marrow and fat-derived stem cells. If you haven't had much liposuction done before, harvesting fat for adipose stem cells is anything but simple. With fresh harvests, you never get just stem cells alone. Some patients say, "Wow, I feel great," within a few days, which can create expectations, which can make it feel like a cure-all, and that's the danger.
Why can't we freely use the term stem cell injection?
Great question. The term stem cell injection is prohibited in medical advertising. The term stem cell suggests high-end, cutting-edge medicine and can inflate expectations as if it were a universal cure, and yes, people do come in believing that. Some arrive expecting, "There's nothing stem cells can't fix." That's why the term is restricted in public marketing.
Why use a complex term like SVF?
Stromal means the scaffold that supports your cells. Vascular, as you know, refers to blood vessels, and fraction simply means a separated component. When we extract SVF from fat, using collagenase and centrifugation, the bulk fat is removed, leaving adipose-derived stem cells, plus a host of neighboring cell types, collectively called SVF. So SVF isn't pure stem cells, it's a mixture. With a fresh prep, you can't isolate only the stem cells, all the other components naturally come along as well. That's why we use the precise name stromal vascular fraction. It is a specialist term.
Is SVF actually good for arthritis?
Arthritis? A lot of older folks suffer from it. On x-rays, stage 2 or 3 is common. That's when the knees always ache. Studies show SVF shots can be a real game changer for them. Papers in the American Journal of Sports Medicine and others show better function and less pain in degenerative arthritis. These are truly remarkable results. That's why bone marrow stem cell therapy is already being used here in Korea. And now fat-derived stem cells have been approved too. So both bone marrow and fat-derived therapies are recognized as effective.
So fat stem cells should have to do liposuction, right?
Yes. Fat-derived stem cells come from fat tissue. So yes, you need liposuction to harvest those. Bone marrow or blood stem cells. Those are easier. They don't require the same technical skill as harvesting fat stem cells. But for fat stem cells, we usually collect from the belly or thighs for volume, but we don't want those areas to end up lumpy or uneven. For the best results, suction pressure, the cannula, the technique, it all matters. And for those considering it, you need to have the procedure done at a hospital that is skilled in liposuction. Make sure to go to a clinic with proven expertise in liposuction.
Are there any drawbacks or side effects to SVF?
Remember, SVF comes from your own body. So honestly, there really aren't many downsides. In fact, one big advantage is that besides stem cells, you also get cells that build blood vessels, cells that modulate your immune system. From my long-term clinical experience with stem cell treatments, I've noticed patients generally fall into two groups: the early reactors. These are the people who say, "Wow, I feel amazing," just a few days after treatment. The late reactors, they don't really notice improvements until 1 or 2 months later. My guess? Those quick results probably come from the growth factors and other components in SVF rather than the stem cells themselves. In reality, it typically takes about 1 to 2 months for the stem cells themselves to exert their therapeutic effects.
Doctor, what's the cost per shot?
The price? Autologous fat-derived stromal vascular fraction, SVF. Injection is now officially approved as a new medical technology for patients with stage 2 or stage 3 knee osteoarthritis, and its effectiveness is considered comparable to bone marrow stem cell treatments. So for these patients, it's been recognized as a valid and effective treatment option. What does this mean? It means some of the cost can now be reimbursed under private medical insurance. Even if it's not the full amount, partial coverage should still make a difference for many patients.